Hi, this is Dr. Girish AC, consultant plastic and cosmetic surgeon. I am heading Curls and Curves Cosmetic Surgery Center, Vijayanagar, Bengaluru. Rhinoplasty, also called as nose job. It is cosmetic surgery which corrects the nose shape and breathing issues. So usually we treat the septum and the shape, that is functional problem as well as the shape together. That is why it is also called as septorhinoplasty. Rhinoplasty is done as a daycare surgery under general anesthesia. So usually the morning admission happens, evening discharge will be there. So after that they can have the food normally. So there can be some minimal bleeding which will be there for next one day, and after that it will stop. The pain will be very minimal, I can say, because majority would think so there will be pain because we do in the face and all. So definitely not. The pain will be very minimal and it will be controlled with the painkillers. With the discharge, so they will be very comfortable at home and they will stay for next 1 week at home because of the splints over the nose. After the surgery, so they can have normal food from same day evening. So there will be some minimal bleeding which stops after just 1 day. So post that, if they have some breathing issues, they can come to us for some suctioning. If we do the suctioning, we can remove the clots that might be causing obstruction. After that, they can breathe normally for next 1 week. So there will be some splints over the nose. So these splint, that is called as external splint over the nose, and one splint inside the nose called as internal splint. So these splints are removed after 1 week. Immediately after the rhinoplasty surgery for next 1 week, they can have body bath, but regarding the face wash and head bath, that can happen only after 1 week. The pain will be very minimal, and it is also controlled with the painkillers. If they have a scope to do work from home, they can do that work from home job from next day also for next 1 week, and after that, of course, and they'll be fit enough to do the offline works also. Otherwise, they can resume their routine activities after having 1 week rest. Initially, after the 1 week, the nose, it is slightly swollen, especially the tip and the whole nose. So the swelling will be to an extent of 4 to 5 millimeters. And we advise some tip massage to decrease or to settle the little swelling. Naturally, whatever the swelling is there, that is minimal swelling, 4 to 5 millimeters. So this reduces very gradually over a period. So at the end of 1 month, maybe around 50% of the swelling will be reduced. At the end of 3 months, 75% of the swelling, that is around 3 millimeter of 5 to 6 millimeter is reduced. At the end of 6 to 8 months, more or less the whole swelling is reduced and the final shape can be appreciated. Nevertheless, the nose looks better than before even after 1 week, and after that it continues to improve. If somebody is having some important event like maybe marriage, close relatives marriage or some event, so they should always consider the rhinoplasty at least 2 to 3 months prior to that very important event, because of some swelling, and the swelling reduces to a decent level by the end of 2 to 3 months. So they need not stay at home, they can go outside, but major physical activities like gym work can be started after 1.5 to 2 months. Otherwise, they can resume the normal walking, other things even after 2 weeks time. So there is no extraordinary or much care, but there will be a natural improvement in the nose which can happen over a period.